Welcome to On Deck with Mercury. My name is Mercury Payton. I'm the town manager of the town of Vienna. And this evening we have a conversation with our guest, Dr. Gloria Addo-ayensu, who is the director of the Fairfax County Health Department. Dr. Gloria, hi, good to see you this evening.
Hello, good evening. Thank you for having me.
Absolutely. And before we get going this evening, as we have started every On Deck with Mercury, just wanted to remind everyone out there to do the 4 things that we've been asking you to do to stay safe and to slow the spread. And that is to social distance as much as possible, to wash your hands frequently, to wear your face coverings when you're within 6 feet of someone as much as possible, and to stay home if you're sick. And if we do these things, we can certainly slow the spread. And so, Dr. Gloria, you've taught me well, and I've been reciting these things for the last about 4, 5, 6 months or so. So thank you for giving that advice to me. I really appreciate, first of all, you spending time with us every week. The audience doesn't know this, but I feel like you're a part of our team here in Vienna because every Friday we're on a call with you and some of the others in the region. And so I think you feel like part of the family here in Vienna and the region. So I really greatly appreciate your accessibility and your willingness to give your valuable time to us to help us during this pandemic.
Of course, it's my pleasure. And I do feel a part of the Vienna family as well.
So I've got a few questions for you. In the format that we have here, we have a series of questions, and that'll be the first hour or so, and then we'll open it up to those who are online who have questions, and we'll fill those questions for the last hour or so. So the first question has to do with how the media every day is sharing with us these things that are going on around the country related to the pandemic that are kind of bad things. It's kind of bad news, of course. Provide us with some data that you think is important for us to know that's related to the current situation in Fairfax County, in the Nova region, as well in the state.
Thank you. Indeed, it's unfortunate that the numbers are climbing quite rapidly throughout the country. Northern Virginia is no exception. We are currently experiencing high disease burden, an increasing trend, and our community transmission level is substantial. So for anyone who's been tracking the Virginia Department of Health pandemic metrics, that the substantial community transmission level is the highest level that is on that dashboard. And so our cases are continuing to surge. New cases are increasing at a level that we haven't seen before in this pandemic. The 7-day average here in the Fairfax Health District is, I think, today exceeded 400. So today's new cases from yesterday was actually more than 700. But if you've been looking at the pandemic metrics, we tend to look at things in terms of 7-day averages. And our 7-day average here in the health district has exceeded 400, which is much higher than we ever saw before the lockdown in March.
So with that number, the 700 number that you're talking about, and we've been watching the positive numbers, just want to ask you real quickly, what are some of the important metrics that residents should look at? I know that the media pushes certain numbers and data points, but residents in Vienna, when they look at the dashboard that you have and those numbers, what should they be looking at specifically and be most concerned with?
So certainly the numbers, the cases are important. And the number of hospitalizations, because we are trying not to overwhelm the hospitals. I think people have done well, in the last several months, simply because the numbers were much lower. Certainly, we've come a long way in terms of medical care. So the treatments that are available are also much improved. But hospitalizations are important, and they tend to lag the cases, so they could be a little misleading. Obviously it takes a while for people to get sick and then to decide, to see whether they recover or not. Some people progress and become more severely ill, and at that time seek health care and hospitalization and so on. And then the deaths also trail that by a bit. So as we see the numbers surge, we have not seen the hospitalizations rise up as much, but we should not think that it may not happen, because as I said, these are lagging indicators. So we should be careful of that. Hospitalizations matter, especially at this time of the year when we do have also flu season, and the possibility that if we have a confluence of those two activities converging, that our hospitals might be really overburdened, and healthcare professionals there might not be able to take care of the increased number of people there, which is why we've urged people to get a flu shot, because that's something we can do to protect ourselves, our loved ones, and our community at large.
Yeah, you mentioned the lag in the numbers, and so do you anticipate a Thanksgiving-related extra surge this week or the next week? So we're beyond Thanksgiving now. Do you think that we may see a surge in numbers that's due to Thanksgiving activity?
I think we're seeing that now. The incubation period is up to 14 days, which is why we ask people to quarantine for 14 days. But certainly people can start becoming symptomatic, symptomatic and actually begin to shed virus anywhere from 4 to 7 days, typically 5 to 7 days. So I think we're seeing what we're seeing now is a result of the Thanksgiving surge that the post-Thanksgiving surge that we have actually talked about.
Okay, great. And what's your top concern right now? Is it burnout of medical and public health staff? Is it the hospital capacity? What's your top concern?
Well, I think all of the above, because they impact one another. So, there are a confluence of factors that are converging that is very concerning. So the surge in itself is concerning, the numbers. And as I said earlier, that's because those numbers can overwhelm the healthcare system and then the public health staff. And although we have a vaccine on the horizon, we're quite a ways off before we can reach herd immunity. And it will be a shame, really, that people, it'll be a shame if lots of people get sick between now and when vaccine becomes more widely available, and especially disappointing if people should die. So all of those issues that you mentioned right now are things that we're actually seeing right now, and they are coming together is not a very good thing for our community.
Why are cases spiking in the U.S. Such a high rate now? Why do you think that is? And at what point would you recommend that we here in Vienna and Fairfax County do something differently, like maybe close businesses or restrict further access to public places? What are your thoughts about that?
So in terms of the cases spiking, I think as I mentioned earlier, it's a confluence of factors. So it's cold, we're spending more time indoors, it's holiday season, we are spending more time together with friends and family. As a result of the holidays, there is increased travel. And over time, since the lockdown, we've been increasing the amount of time that we spent in restaurants, You know, gym attendance has increased, and other things like that. And then I think part of it is also just what we've been calling mitigation fatigue. I think after 9 to 10 months of being asked to, wash your hands, cover your cough, stay home when sick, stay 6 feet apart, wear a face covering, and so on. I think people are beginning to get tired of that and are not practicing those guidances as consistently as they should. But this is not the time, as I said earlier, to to relax the simple but challenging actions that we're asking people to take. In regards to your question about what we would do differently, I think that there's nothing more to do. I mean, these messages, these actions we're asking people to do are very effective. The problem is that we're not doing it consistently, and so we just shouldn't, for something so simple, we should make every effort to practice them so that we can avert the, surge in cases, the hospitalizations, and the deaths that are staggering, throughout the country every day. Lots of people are dying, and it is really a shame because to some extent this is preventable. The action that I talked about is what it's going to take. Um, you know, the decisions about scaling back, like we did in the spring, is really is really one that the governor and only the governor can make. I believe at his recent press conference, he mentioned all options remain on the table, but he wants to give sufficient time to, analyze data from the latest information or the latest information from November. So I think he's looking at all of these cases and how busy the hospitals are and the availability of PPE and that kind of thing. And we'll see what he and his advisors recommend in the near future, if anything.
Yeah, you just alluded to this about the safe practices, and we've talked about this, and we opened up with the 4 things that we talked about as far as keeping everyone safe, washing your hands and wearing the face covering, the mask, and such, staying home if sick. Why is it so important for us to do these simple things?
Because that's all we've got, and it works. When we think about how the disease, how COVID is spread, it's spread through respiratory droplets that typically don't travel more than 6 feet and then fall to the ground because these droplets are heavy. And so that's why the 6-foot social distancing recommendation is in place. If you stand 6 feet and beyond, then it is unlikely that these respiratory droplets will actually reach you. Why the masks? Because when you wear a mask, you actually protect yourself as well as the person who is standing in front of you, who will likely, receive your droplet without that mask. So again, the recommendations are really based on what we know about the transmission of the virus. And hand washing, why? Because sometimes people cough into their hands. They rub their nose because they have nasal drips and so on, and then they don't wash it, and then they touch something, and someone else comes up to them and touches that same object, and then touch their eye or their nose or their mouth and get infected. So that's why the hand washing and covering coughs and sneezes recommendation is in place. And then the staying home when sick. Why? Because it's sick people who are infected with COVID, who are actually transmitting it to others. But if you stay home when you're sick, then that decreases the chance of you exposing someone else and transmitting the infection. So those messages, those measures that we're asking people to take, simple but yet powerful. And as I said, that's all we've got right now until we get a vaccine.
Yeah, that makes a lot of sense. So do you have a magic motivator, so to speak, that would encourage folks to follow these measures that you could pass along to us that we could use?
I think it's just just to appeal to people that as you know, as individuals in the community who interact with many people in a community, some of whom are vulnerable, but we will never know who the vulnerable amongst us are because they look just like us, that it behooves us to take personal responsibility to do the right thing. It's just the right thing to do. I think sometimes we want to be lazy, we want to do, we don't think about it, but it has to be intentional. These are unprecedented times, and every day we hear from the news that people are dying and the numbers are climbing. I would hope that it would speak to us as individuals to see what else we could be doing to to limit the spread of disease within our community. And if you're wondering what that is, what you could do, it's those things. Cover your coughs and your sneezes. Wash your hands frequently. Wear a mask when you leave outside your home, and when you're outside of your home, and make sure that you are socially distanced and that you maintain a 6-foot distance between you and others.
So let's talk about the vaccine a little bit and the hope that we have in that getting out to the public here in the short term. When do you expect the first doses to be injected into the arms of residents of Fairfax County, and who will be in line to be the first to be immunized?
So as you may have heard, Virginia is preparing to receive an estimated 480,000 doses of vaccine from 2 manufacturers. The Pfizer and Moderna vaccines are the ones that we've heard quite a bit about. These vaccines are in the process of receiving their emergency use approval. If all goes well and they are approved on, I think the body that is approving, that is looking at these vaccines is convening on the 10th of this month. And so if all goes well and they are approved, then vaccine could arrive soon after that. The first to receive the immunization, so ACIP, the Advisory Committee on Immunization Practices, has prioritized who should be receiving vaccine first. And at this time, it is earmarked for healthcare providers as well as residents of long-term care facilities. So when vaccine arrives in our community, they would be the first to be vaccinated. As I said, Virginia is looking at about 480,000, and it is estimated that there are about 500,000 healthcare providers and long-term care residents in Virginia. So that should cover it to the extent possible.
So who's responsible for distributing the vaccine, and how will it be distributed?
So there are a number of players in this. Initially, for this group of people that I talked about, because they are healthcare providers, they will be vaccinating. So the healthcare systems will be vaccinating their own employees and so on. And then the residents of the long-term care facilities, they are going to be vaccinated through a program, a federal program between the pharmacy chains, CVS and Walgreens, and the long-term care facilities. So all that has been arranged, and vaccine will go directly to the long-term care facilities through the pharmacy chains. When more vaccine becomes available, public health will be playing quite a significant role, like we did for those of you who are watching and remember H1N1. Public health will be responsible for the next tier of people who will be is what we call essential workers, and there are quite a number of people in that group. The list is still being looked at; it hasn't been finalized. But right now, you have folks like EMS and people in the transportation business. We have educational staff and so on. I'm kind of blanking out, but there are quite a number of groups in that second tier. But as I said, it has not been confirmed yet. So they're still deliberating about who should be part of that second group. But for that second group, public health will play quite a significant role, and we will be dispensing vaccines in a variety of ways. We'll be planning, if we have large quantities, then we'll be doing similar to what we did in the government center in 2009. We'll have the different groups come into that setting or to our clinics. We have 5 district offices in Fairfax, and we will be providing vaccine through those avenues as well for smaller quantities of vaccine that are received. And then as time goes on and more vaccine becomes available, pharmacy chains will have vaccine just as they do for flu during flu season. Our healthcare providers, our primary care providers will also receive vaccine. In fact, they have already been, over the last several months, through VDH and the local health departments, providers in our communities have signed up to receive vaccine when more quantities become available. So they will be in the mix as well. So, come, April or so and beyond, I think there'll be sufficient vaccine in our community that people will be able to either receive it through their private doctor or through a pharmacy or through local public health as well. And so there'll be a number of choices that people can choose from.
Now, will residents and citizens, will they have to pay for it, or will their insurance cover it? Like, how will that work?
So the residents may be charged an administrative fee, but it will be covered by insurance. So basically, nobody should have to pay out of pocket for vaccine. If in some settings, like in your private physician setting, you may be charged an administrative fee, but that'll be billed towards insurance. So it's going to be a little different in different places. We, for example, if we're to host mass vaccination clinics, we will not be going through that billing process at all because of the speed with which we will need to move people through it. And also because, the government has invested so heavily in these vaccines already. So for the citizenry of this country, vaccine should be free to them.
Well, what is your message to those who are concerned about the safety of the vaccines that have been approved or about to be approved? I think there are about 3 or 4 that maybe are approved already or about to be approved. What's your message about people who are concerned about the safety of the vaccines and are skeptical about vaccines in general?
Yeah, many people are concerned about vaccines, but there's so many vaccines out there on the market, and they are safe, they are effective. If you compare, the adverse events that can occur as a result of receiving a vaccine versus the repercussions that people suffer from getting the disease itself, I mean, it is markedly worse off. People are markedly worse off when they do get the vaccines. And we've seen with COVID, we've seen the cases, we've seen the death rates and so on and so forth. The vaccines, the COVID vaccines, the mRNA vaccines that are awaiting authorization have been held to the same rigorous safety and effectiveness standards that they've been shown to be effective and safe. So I have no concern about the vaccines. I know people may be a bit skeptical and not so sure because of the speed with which these vaccines were actually produced. In the past, we've talked about how it takes quite a while for vaccines to be developed. The difference this time is that because of the devastating impact that COVID has had on our communities throughout the world took a different approach this time and said, we're not going to wait to go through all the clinical trials. And all the clinical trials were carried out exactly as clinical trials are done in the past. But in the past, these clinical trials are done. So, the first phase, second phase, and the third phase, and based on whether they are successful in terms of the efficacy and safety profile, then vaccines are begun to be developed. This time around, the world didn't wait for that process to finish, but concurrently, as these vaccines were showing promise, the federal government infused money into these vaccine companies and encouraged them to continue to begin to make large quantities of them, so that in the event that they are proved successful at the end of these clinical trials, that we would have vaccine right away and can begin vaccinating people. So that's what's happened. There have been no shortcuts. It's just that all the processes that that are done sequentially have all been done at the same time.
So with regard to the vaccines, at least one of them we've heard must be kept in ultra-cold storage. How will distribution sites be able to maintain those required sub-zero temperatures and dispense the vaccine in a lot of time that the vaccine is thawed? How does that work?
So for the ultra-cold, for the vaccine that requires ultra-cold storage is the Pfizer vaccine. That's the vaccine that's one of the vaccines that's coming out pretty soon. And as I said, they're going to be distributed to healthcare systems, to pharmacies and public health departments, all of which have the cold chain storage capability. So that will not be an issue. By the time vaccine becomes more readily available to the broader community, the other vaccines would be available, and those do not require the cold chain, this ultra cold chain requirement. So the doctors' offices and other places that would like to participate in vaccine distribution would be able to do so without this challenge.
So how important is it that a certain percentage of us get the vaccine? Or what is the percentage that will provide the community with adequate protection?
I guess what
target
what you're referring to is herd immunity.
Right,
And
right, right.
yes, so herd immunity, if I can explain. So, vaccines protects individuals, but it also protects communities when enough people develop immunity and therefore prevent the germ, or in this case, the virus, from spreading easily. That's what we call herd immunity. And for COVID, it is thought that we can reach herd immunity when about 70% of people are immune. And so that's going to take quite a bit. If you look at our case numbers for the Fairfax Health District, I think today we are around 34,800 or so cases, and we're 1.2 million strong. Um, so um, even when you factor in the asymptomatic cases that may have gone unnoticed, we still are at best around 8% in terms of the we're not more than, I should say, not more than 8% of us have been um, have been infected in the past, as a recent VDH serology study has indicated. So that means the vast majority of us, 92% plus of us, are still immune. And it's going to take quite a bit of people getting vaccinated to reach that 70%, to then reach herd immunity. And that's how we all should participate. I think we shouldn't think of herd immunity as, oh, I'm going to sit back and let 70% of our community get vaccinated, and I'll be part of the 30% that don't. It's going to take all of us. All of us that can get vaccinated should get this vaccine, because we don't know um, um, how long immunity will last. There's some people with, who are immunocompromised and have other health challenges, for whom we don't know um, how effective the vaccine will be. And so, as long as we have vulnerable people amongst us, I think it behooves all of us to get vaccinated as vaccine becomes available.
So we know that two companies are currently seeking FDA approval for the vaccines, and others are in final clinical stages of testing. Will people in Fairfax County be able to choose which vaccine to get, and is one particular one better or more effective than the other?
So in terms of the two vaccines available right now, the Moderna and the Pfizer vaccines, they are both mRNA vaccines with similar efficacies and safety profiles. So either one is fine. However, they are not interchangeable, meaning that both of these vaccines require a second dose. And for the second dose, you must get it from the same manufacturer as the first dose. But starting off, either formulation is fine. But the second time around, if you got Moderna the first time, you have to get Moderna the second time. And if you got Pfizer the first time, you have to do the same for its second dose. Later on, when there's, vaccine, when the other companies, if they should get their vaccines approved and they're on the market, then people will have a choice. And I guess when you go to your private doctor's office, it'll depend on what vaccine they are carrying. Certainly, they will not be carrying these they will not be carrying the Pfizer because of the ultra cold chain requirement, but they could have any of the others. And I guess you'll just have to um, use whatever your provider may have, which is sort of similar to what happens right now. I mean, there's so many, formulations of, let's say, the childhood immunizations, and you kind of get whichever one your provider is carrying. Same thing with the flu vaccine. I know with the flu vaccine, when we had what do you call it, the nasal mist, the flu mist, you could ask for that or for the shot. But in terms of the injectable vaccine, there are several of them, and you typically get whatever your provider has.
Will this vaccine, and you mentioned the flu just a moment ago, will this vaccine be a one-time thing or something that we'll have to do annually like the flu shot?
I think the verdict is still out on that. We just don't know. We barely started our vaccination, our mass vaccination within our communities, and we'll just have to wait and see. We're learning a lot about COVID. We do know that people who have gotten the disease have they have made antibodies. The immune systems have made antibodies, and the antibodies have persisted. But it's too early to tell, and we don't know how the vaccine, how long the protections will last. We do know a little bit about coronaviruses, and the common cold is a coronavirus. We've all experienced a cold more than once, so that immunity doesn't, the immunity from the common flu doesn't last as long at all. But we don't know how it will be for COVID. If I could make an analogy with, let's say, H1N1, we don't talk about H1N1 much, but the virus still circulates, and people may know or not be aware of this, but the seasonal flu vaccines actually do contain H1N1 virus, because the virus continues to circulate. So who knows? We'll have to stay tuned for COVID.
I understand. Do you expect people to have to wait in long lines to get the vaccine, as some folks have had to do when they're getting tested, or do you expect the lines to be shorter?
So for the vaccine clinics, we are planning to make them appointment-only vaccines. And so that will limit the need for people to stand in long lines. There might be a little bit of waiting as people wait for their turn, but we don't expect to have the long lines we did with H1N1. It's cold, which, long lines actually having people congregated like that could actually increase the transmission and so on and so forth. And so we're trying to limit that this time around.
Sure. So I think a lot of people are curious to know the answer to this question here. So with the vaccine on the horizon and all that we know about the virus, when do you think we'll be able to host and attend large-scale events again of more than 1,000 people? We want to have even Vienna. We want to have our festivals again. And so, when do you think we'll be able to start cranking those back up?
So, I don't know. For one thing, I know is that it's going to take a while for us to reach herd immunity, right? Probably through next fall. If all goes well, we could actually have that, proportion of our community vaccinated by then. But until that happens, I don't think that we will be, that we will be, stepping back or loosening the restrictions anytime soon. And again, as I said, these kinds of decisions really are decisions that the governor and his advisors make as they follow the data and see where the vaccination program and see how rapidly the vaccination program is progressing and so forth. So we do have, it is going to take a while for us to get back to normal. And I hope that people will not see the vaccine becoming available as an opportunity to just let go of all the public health messaging we've talked about, and that people will still exercise a little restraint and patience. I know it's been a long haul, but we're not quite, there is light at the end of the tunnel, but it's still quite a long tunnel. And we need to be patient and do the right thing so we don't, jeopardize the lives of the vulnerable amongst us.
So kind of following up with that question, so I just picked Viva Vienna out of thin air, but Viva Vienna is in May, and so you have the vaccine out, and we have these precautions about washing hands and all those types of things. So whenever that is, I mean, whether it's May of next year or June or August or whenever that is, do you think that there are going to be some measures and precautions that we still will be using and recommending while we have bigger gatherings? So we may have the bigger gatherings, but are you expecting us to continue to have some of the precautions with those bigger gatherings?
Yes, I hope we never stop washing our hands. I hope we never stop covering our coughs and our sneezes. And in terms of the face coverings, we do know that it works. And so, I mean, short of until we've reached herd immunity, I think that would be a recommendation that we continue, because you don't know who you're talking to. You don't know who you're going to be meeting in the in whatever social setting that you go to. You don't know who's immunocompromised and so on and so forth, or who has an underlying medical condition. So I think we'll have to practice those those precautionary measures for quite some time.
So I've asked a lot of questions about vaccines. I think everyone here knows probably more than they've ever known about vaccines in these last few minutes here. What else should we know about vaccines and its distribution?
So first of all, I'd like to, I think it's important for people to know that these vaccines are safe. We're still learning about it, but all indications so far says they are safe, they're effective, and so that should hopefully ease people's anxiety about getting it. There are two ways to get immunity. Either you get the disease and hopefully you survive it, or you get a vaccine. And it's been a long year. This virus isn't going anywhere. It could be a long 2021 if we don't try to achieve herd immunity through vaccination. So, as I said earlier, I encourage everyone to get the vaccine, and we've come together all these months, and we need to work together again in the next few months through next year to get vaccinated and reach herd immunity, which will be in the interest of all of us here in the Fairfax Health District and the country and the world.
Mm-hmm. And you just kind of alluded to this. When do you think we'll be able to say that the pandemic is over? Like, what would that mean? I think you just mentioned that the virus is going to be with us. But at what point will we say, okay, what we're experiencing and living through right now, we can turn the page on that and start a new chapter with all of this?
I think when we've reached herd immunity. And I think before then, we're still going to see, and even then, when we've reached herd immunity, if for people who are not vaccinated, if the virus is circulating, they will succumb. They will become sick. And so, but I think that, until we've reached herd immunity, which I said earlier is probably the summer or fall of next year, if all goes well and vaccine is you know um, is produced on schedule, on some kind of a regular schedule, and is available, and people put out their arms to receive the vaccine, we will not make that progress.
Sure, sure. We've talked about this on some of our weekly calls. Vienna's working hard to support businesses through this difficult time, as is Falls Church and Fairfax City and other Fairfax County, Northern Virginia, all throughout this region, trying to support businesses. So what activities in your view are safe if we want to communicate to Vienna businesses and customers and patrons who go to our stores here in Vienna? What would you recommend? Shopping at local stores, dining in restaurants, picking up, or outdoor dining? So what is your thought process that we can encourage here in Vienna?
So, in a pandemic, nothing's 100% safe, but all the measures that we take are to make things safer. So obviously outdoors, and so it's about risk and limiting your risk. So outdoors is better than indoors. Obviously, wearing a mask is much, much better, and is recommended. Then it's better to wear a mask than not wear one. As it relates to dining in restaurants, so outdoor, as I said, outdoor dining better than indoor dining. But even eating out has its risks, and that is because whether you eat out or you gather at home for Thanksgiving and so on, congregating around food has its risk, because you can't eat while you have a mask on, so you have to remove the mask. And we've all, been out for dinner or lunch or whatever, or sat around the table with family. Whenever there's food, people talk a little louder, especially when there is alcohol involved. And so we tend to speak louder. And when we speak louder, our droplets carry a little bit more farther. They travel a little bit more farther. And if we're infected with COVID, if anyone is should be infected with COVID, during that time, there is a higher likelihood that others can be exposed. Sometimes when you have large number of people around the dining table, and as I said, we tend to speak louder. For people sitting next to each other, they might want to maybe lean in just to hear each other. And again, leaning in then allows you to violate the 6-foot social distancing, so that even if you are not speaking loudly, someone else is closer to your droplets and can become infected. So congregate eating is a high risk activity, and that should be really limited to people in your own household, people you live with all the time. Yeah. So in terms of, I think your other question was about what businesses can do. I think businesses can enforce the mask use. They should also encourage people when they are not eating to put back their masks on. And they should ensure that the seating arrangements really adhere to the 6-foot social distancing recommendations.
And that makes sense. Let's go back a little bit and talk about testing. When should someone consider getting a test? And if someone thinks they need a test, what should they do? And how long typically does it take for the test results to come back?
So I'll start with the last question about how long it takes for the test results to come back. I think we've come a long way. The beginning of this pandemic, it took too long for test results to come back, and we had all the horror stories. I think now most commercial lab testing results are back within 3-4 days max. At the health department, we have our own lab that supports testing associated with investigations, with contact investigations and so on. And we have a much shorter turnaround time of 1 day. But I think by and large, the testing results are coming back a lot more quickly than in the past. In terms of who should get tested, we recommend that certainly anyone who's symptomatic should get tested. Anyone who's been exposed to someone who has a COVID diagnosis should get tested. And anyone who's concerned about possibly, acquiring COVID, either because they've traveled recently and are concerned. Testing is more widely available now. And in Fairfax, for example, in the Fairfax Health District, we have over, something like 50 sites where people can go and get tested. Anyone who's interested should visit our website, and there's information about these testing sites, how much it costs, and the phone numbers, the addresses, and so on.
Mm-hmm. Is there a reason to believe that there are many false positives or false negatives with testing? And is it possible that occurs? And what are the reasons someone might test negative if they actually do have COVID?
So it depends on the test. Some of the tests are more accurate or more reliable than others. Obviously, the two diagnostic tests that we've been using, like the PCR tests, and then now we have the antigen tests. So they are both diagnostic tests, and which means that they can be used to determine whether a person currently has an active coronavirus infection. However, they are different. There's some differences between the two types of tests. So the PCR test is more accurate. It has fewer false negative results. And that's the diagnostic test that we've been using from the beginning. And then the other one is the antigen test. The antigen tests are newer. They usually provide quicker results and are therefore best utilized in the clinical setting for people who are symptomatic. However, they tend to have more false negative rates. They have higher false negative rates and also higher false positive rates, which is why they're recommended for people who are symptomatic. With these tests, when the prevalence of disease is low, and there is a lower likelihood that a person who's being tested doesn't have disease, then it actually enhances these false positive rates. So the PCR tests, as I said, they're more accurate, but the antigen tests can be problematic, and there's quite a number of them on the market. So it's important that you go through a healthcare provider, someone who can evaluate to see if you have a higher, if they think that you have your symptoms are consistent with COVID, then you have a higher likelihood that the test will be, if it comes out positive, that it'll be truly positive, and that if it's negative, that it is truly negative. And then the third types of tests, I don't know if people might be thinking, so we also have the antibody tests, but those are not diagnostic tests. They're not for diagnostic purposes, but rather they tell you whether you've been infected in the past with COVID.
Right. With regard to the positive case and the deaths number, it appears as to date that there have been 615 deaths in Fairfax County associated with COVID out of 34,000 positive cases, which is a recovery rate of in the neighborhood of 98%. So is that in some ways good news regarding how our bodies are handling the virus? I know that we've been talking about the 4 things that we should do to slow the spread. And if someone does contract COVID, is it highly unlikely that they will die, with the mortality rate being what we're seeing with this virus?
So the thing with COVID is it really depends. For healthy individuals, the vast majority of healthy individuals, it's either a symptomatic illness or a or a mildly it's either an asymptomatic illness or a mildly symptomatic illness that typically resolves. For some people, people with underlying medical conditions, that is not the case. And as we've seen for the elderly who not only are advanced in age and have weakened immune systems and tend to have comorbidities, that is not they tend to have severe illness and tend to be hospitalized and unfortunately at high risk for death. Even in Fairfax, in our health district, I think in excess of about 80% of people who have died from COVID are the elderly, and I think 60% or so are the elderly who are in long-term care facilities. So it's amazing how the same virus manifests in different groups of people, the young versus those who have underlying medical conditions, and then versus the elderly. But overall, yes, people who do come down with COVID, who acquire the infection, do recover. Although for some also that even after they have recovered, some of their symptoms do linger on for quite a while, like the shortness of breath, like the fatigue, and so on. And it's hard to determine ahead of time how people are going to be impacted by COVID, which is why it's prudent to protect yourself and others. And hopefully when vaccine becomes more widely available and is, more widely available for the general public, that we recommend that the general public as well takes advantage of that.
Sure, and along those lines, for patients who have a difficult experience with COVID and may end up hospitalized, what's the trajectory of their experience, and when do they typically exhibit dangerous symptoms?
So typically, the COVID illness, COVID tends to be quite insidious in the beginning. Most of the time, even people who end up not doing well or doing poorly, in the beginning, they don't seem to be that sick. And then day 5, 6, 7 is when those with underlying medical conditions and and those who are going to be, suffering from the complications seem to turn. So it's important, if you do know that you have an underlying medical condition. Obesity is one of those conditions, diabetes, um, um, cardiovascular disease, and those advanced age. Um, those types, the people with these conditions should um, check in with their healthcare providers if they have symptoms consistent with COVID. It's, even if you get a test without that was not ordered by your provider, if you are in one of those high risk categories, you should let your provider know, so that you can get good advice, and they can help you know when some of the warning signs are. Obviously, anyone with COVID, even if you don't have any of those underlying medical conditions that I talked about, if you should have difficulty breathing, that's a sign that you should seek help from a healthcare provider.
Yeah, that's very helpful. Now, we all know that the Christmas and New Year's holiday is coming, and many people will be gathering. How can people do that safely as we round out 2020?
So I think people have heard, the public health guidances about gatherings during the holidays. Small gatherings is what we recommend. Small gatherings, and gatherings for friends and families. People in your already in your household, if possible. Host outdoor gatherings if it's possible. Require guests to stay 6 feet apart at all times. Wear your face coverings at all times except while eating. And I think this year is a year for us to do things differently if we can, because it's the challenges that we faced with COVID is unprecedented, and for some it is so deadly. If you have household members, or you have family members who have underlying medical conditions, please stay home and don't go and visit them. You can celebrate virtually with them. And we always have next year. But, if we should make our loved ones ill, and if they should die, then we won't have next year with them. So I think that, look at us doing, having this meeting virtually. I didn't think that we could do that last year, but we've done so many things this year through Zoom and all these other platforms that I'm not high tech at all. So I never even thought all of these things were possible a year ago. And I think that we can use technology. We can be creative. If you can drive to see grandma, and it's not too far, and just to go wave, that's something. But we should try to limit interaction with our loved ones who are vulnerable, especially because vaccine is so close that I think it's really unfortunate, and my heart goes out to anyone who is elderly or has an underlying medical condition, who is going to be falling ill between now and the next 4 or 5 weeks, when vaccine is going to be available to those individuals.
Is it safe to fly? I know some people may be wondering about that.
So it is, is it safe to fly? I hope people recognize that it's safer at home, and that we need to limit unnecessary travel. If you need to travel, then hopefully you are wearing your face covering, I don't even think the airlines allow people not to wear face coverings anymore. But if they do, you should wear a face covering all the time throughout the flight. And, you know, hope for the best. I will not travel during during this time. I don't think it is number one because I don't have any pressing travel to to do. And if I did, then I would take that advice and make sure that I wear a face mask and um, not socialize too much at the airport and so on.
So if we could go back in time, which obviously we can't, but if we could go back to March, even January, February, are there things in our nation or even in Fairfax County that we could have done differently to prepare for all this?
Good question. Hindsight is always 2020. But a lot of the consequences of COVID that we're witnessing is really not a surprise to public health. I mean, I think community overall underestimated the social economic impact of the pandemic, and that if they completely understood, I believe that they would have taken the health messages a bit more seriously and tried to practice them consistently. So, it's, and, one of the things that for me, I have found is, a little discouraging sometimes, is the fact that these public health messages, the actions that we're asking people to do, are things that we've asked people to do for a very long time. And they're so simple and so effective. They're so simple, but yet so effective. And it's unfortunate that people haven't acted on them like they should. So what could we have done differently to prepare for the pandemic? I think we've had these messages up front. These recommendations have evolved, but even with time, as we better understood the pandemic and we're more emphatic about practicing these measures, I think that some people have not taken it as seriously as they could have, maybe because they thought the pandemic would last. It was only a phase. It would come and go, but it's still here and it's not going anywhere, as we've seen.
Is this pandemic something that you ever would have anticipated dealing with in your career?
Unfortunately, yes. And that's why, we began our pandemic preparedness efforts in 2005. So in 2005, public health started talking about, at that time, we were concerned about bird flu. It was the H5N1 bird flu. And so a lot of public health agencies, local public health departments, in collaboration with their county governments, prepared for such an event like this. H1N1 came. Luckily, it was a short-lived, relatively short-lived pandemic, and it wasn't as severe. And we'd all heard about the 1918 pandemic, and was when we're hoping that we wouldn't have such a severe pandemic, but here we are with COVID. So it's been a very difficult year. It's been very challenging for public health, but I think that and for our community as well. And I think that we've done, we've tried to do the right thing. I think that together we need to continue, although we're getting tired, we need to just continue a little bit longer and 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 try to limit the number of people who will fall ill, and most importantly, who will die moving forward.
And you just mentioned people getting tired with all this. So, there may be some, probably quite a few, who are getting exhausted with all this. They're tired of COVID-19. They're tired of talk about the virus and the pandemic and all that. They may want to even throw their hands up. What is your message to those who are getting weary with all this?
We've come a long way. We still have a little bit more to go, but we can do it together. We just need to encourage one another and to remind each other that there really is light at the end of the tunnel. So don't lose hope. Don't be discouraged. Please don't get tired. Continue to wash your hands, to cover your coughs and sneezes, stay home when sick, and let's remind each other to, wear our face masks and maintain that social distance and the 6-foot social distancing. And then as vaccine becomes available, let's participate. We do it for ourselves, we do it for our community, and because it's the right thing to do.
Absolutely. And before we turn to those who might be ready to ask questions online, I want to thank you for taking time out. I always feel more informed when we have our conversations every Friday, and I feel like, again, I'm more informed, and I feel comforted to hear the facts that you give us. The media and the news inundates us with information and perspective. I feel like this is more informative and more reasoned. Would you recommend that people stop watching the news and listen more to you or their health department director, wherever they may live, and maybe go online and go to your website and get direct information rather than from the news?
Well, I mean, I think that, we all listen to the news. They try to sensationalize information, and even without sensationalizing it, just the 24-hour nature of it just keeps repeating, negative information, or even though it's factual, they just, you keep hearing it over and over again. And I think what that does sometimes is that it makes you feel paralyzed. It just makes you feel like, oh, what can I do? There's just so much overwhelming illness. There's so much overwhelming death. And, everyone is into the number counting. I don't think it is a helpful exercise. Quite honestly, for me, I always have to refer, even for the relatively small numbers we have in Fairfax, I have to keep referring to it, because I want to concentrate on what we can do. What we can do, which we have at our fingertips, it's in our health is in our hands. And there's just so much we can do to protect ourselves and others. And it's not easy. Many people think that they know how to wash their hands. Sometimes even when prior to COVID, when we'd have our outreach team go into communities and would talk about hand washing, and sometimes people look at you like, really? You're telling me how to wash my hands? And you feel a little apologetic. But the truth is, we don't wash our hands properly. We don't wash our hands often enough. If we did, we wouldn't have norovirus. We wouldn't have pink eye. We wouldn't have the common flu, even COVID, all of these diseases, Ebola, even hand washing has a huge impact on its prevention. So we obviously don't wash our hands enough, and we don't wash it properly. So it is, we should concentrate on those things. What do I need to do to wash my hands properly? And the best way to wash your hands is to wash it for at least 20 seconds. That's how long it takes for you to sing the happy birthday song to yourself. And you start by, wetting your hands, taking some soap and rubbing your hands together to make a lather, and making sure you're getting behind the back of your hand, in between your fingers. Make sure that when you wash your hands, you kind of go down a little bit, halfway up your forearm, and then underneath your nails, to make sure that you get the dirt underneath your nails, especially when you've used the bathroom. It's important that you clean underneath your nails. If we did that, a lot of illnesses that we experience will not happen. And then encourage others. I think we can be encouragers to one another when we see our loved ones, our friends who are feeling a little fatigued about being cooped up all these months, and then being told we can't do this and we can't do that. Let's encourage each other. Let's see the glass as half full, and try new things. You don't have to do the same things we've done over and over and over again. It's just this year. Who knows? We can, who knows how we will enjoy these new opportunities that having to do things remotely present itself. And then when vaccine becomes available, let's talk to each other. Let's go online to CDC website, the health department's website. Let's read about the truths about the facts about these vaccines, and then look out to see what these myths out there are and debunk them. And together, let's work towards achieving herd immunity for ourselves and for our community and our loved ones.
Well, thank you. That is very helpful. Thank you so much. Again, I learned so much listening to you. So now I think we have time for some questions. We have about 25 minutes or so. Do we have any questions from anyone online? No. And any questions? Oh, no questions at all. You answered all their questions.
That's great. That's great.
Any questions from anyone here? The mayor or no questions? Okay.
There's a lot of questions.
Yes. Well, I think you win the award for the endurance for On Deck with Mercury. So thank you for answering all these questions. I know it's a lot.
It is a pleasure. It's a pleasure. Thank you for inviting me. I appreciate the opportunity, and I look forward to answering any more questions that might come even after this segment is over. Please send them my way via email.
Absolutely. Absolutely. I appreciate everyone out there watching On Deck with Mercury this evening. For more information, go to our website. And in the future, we have in January, our next On Deck with Mercury is going to be on our legislative agenda. We will have our town attorney with us on January 12th to talk about the town's legislative agenda with the General Assembly getting cranked up in January. So again, thank you all for being with us this evening. Stay safe and enjoy this holiday season. Take care.